All right, welcome back to the Emerging Growth Conference. We're happy to introduce our next presenter. We have Progressive Care, Inc. It trades on the OTCQB under the symbol RXMD and is a Florida health services organization and provider of many important services, such as prescription pharmaceuticals, compound medications, tele-pharmacy services, and much more. Joining us, we have Jay Weisberg, the CEO, and the General Manager, Armin Karapetian. Welcome, everyone. Welcome, gentlemen.
Thank you. Thank you. Good to be here.
Good morning.
All right. We look forward to your presentation. Whenever you're ready, please take it away.
Good morning. Thank you. We're very proud to have been asked to present, and we're happy to be presenting today. We're going to do a very informal presentation and just give you a quick overview of the company. And if we have time, we are going to take you on a tour of our beautiful facilities. As Anna said, we are Progressive Care, Inc. We trade on the OTCQB markets under the symbol RXMD. And our primary pharmacy is Pharmco RX. We are at Progressive Care. Our mission is to improve your medical and your prescription adherence on a daily basis. We value our prescribers, our caregivers, and our patients in a seamless manner. Throughout the implementation of our process, we empower medical practices to achieve the highest standards of personalized care. And by that, we take people and we treat our patients as if they're our family and our relatives. We have a complete staff that follows up on their prescription adherence. We follow up if they have questions. They can call almost any hour of the day to speak to somebody, and they're not left out there stranded trying to figure out what they need to do. Before we get into a bigger presentation, we want to give you a few of our financial highlights. Our consolidated revenue for the year end was $40.3 million, representing a 22% increase over our 2019 year end. Prescriptions filled were approximately 530,000. That was an increase of 16% compared to 2019. 340B revenue was $2.8 million. Representing a sharp increase of over 300% compared to 2019. Our COVID testing revenue was $600,000, most of what was in Q4 of 2020. We had positive EBITDA of $7,000 compared to $479,000 negative in 2019. In the first quarter of 2021, our COVID testing has continued to increase, and we're very active in the COVID testing. We go out to see people if they need us, if they can't get into the facility, if they run into, if it's a large group or restaurant, and they call us up and say, hey, someone tested positive last night and we need to test all our employees before we open. And we will send a crew out to test if it's convenient. We don't make them say, okay, get 30 employees into our facility. We're out there proactively trying to keep the restaurant open and keep the community safe. Our financial highlights for the quarter ending March were consolidated revenue was $9.6 million, representing a year-over-year increase of 69% compared to Q1 of 2020. Adjusted EBITDA was $141,000, an increase of $780,000 over the adjusted EBITDA from Q1 of 2020. We had a break-even in cash flow in Q1, and we increased our cash position to over $2.4 million in the quarter. I'm having trouble getting my mouse to where I want my mouse to be. So excuse me, please.
Jay, I'll do it for you. I changed the presentation.
Yeah, our medical adherence management. We're proud of the Smart Pack that we send out, and there's a little picture of the Smart Pack on the screen. These pouches make it easy to stay adherent to your medical needs. Each little pack is, as you can see on the screen, tells you the time of day, the date, the medication that's in the pack, and you pull it off just like you would any roll. It just comes on a roll. You pull them off. So at 12 o'clock you'll have a pack. At 3 o'clock you'll have a pack, and it just makes it very easy to follow up. I think we have one. We have some behind me. You can see on the wall. It helps eliminate gaps in therapy. It helps the monitoring of ACE and ARB in diabetic patients. It meets statin measurements, and it's completely post-discharge medical reconciliation. It makes it very easy to follow where you are and how to take your prescriptions on a daily basis. Armin, you want to move? Risk management is what we're on now. And
yep.
As a 5-star pharmacy, you can count on PharmCo to make recommendations to physicians based on the best practices, currently preferred formulary, and cost effectiveness. Our proactive patient engagement model and advanced suite of pharmaceutical services has been designed to reduce readmission risk, decrease adverse health care, and lower cost, and help increase adherence of your medical needs. The
next one is the data management solutions. You want me to talk about this, Jay?
No, I think yeah. The big thing is that what we try to do, and I'm going to go back to the previous slide. We carefully monitor what the patients get, and what we try to do is some of the new medications have a very high cost. And if we can see that there's a formulary where we maybe can divide a medication into 2 different pills, we will recommend back to the doctor so that they can save the patients money and save themselves money. We're actively managing our patients and trying to take care of them and trying to make their health care less costly and easier to take care of. Armin, you want to talk about data management solutions?
Yeah, I'll just want to talk about the ClearMatrix. So ClearMatrix is the wholly owned subsidiary of Progressive Care. So the mission of ClearMatrix is to be able to provide solutions to the healthcare organizations across the United States that will enable them to manage their risk and manage their data in a much more productive way. So the ClearMatrix side of the business is focused on providing 340B covered entities, third-party administration services, and then also to such organizations as the MSO, managed care organizations, accountable care organizations, provide them with customizable reports that will enable them to see what their drug utilization is. What are the costs of the medication? So, for example, we have MSOs and managed care organizations that come to us and they say, well, we want to know what are the prescribing trends of our prescribers. Are they prescribing a lot of brand medications, or are they prescribing most generic medications, where the opportunities that we have to switch those brand medications to less expensive generic alternatives. So not only that, we actually, just like Jay said, we're there to stop when there's an alternative to generic. We will take advantage of that and stop the brand from being dispensed and dispense the generic. But we also provide all of that data to organizations to make sure that they're well aware of their prescribers and what the prescribers are being, what the patients are being prescribed. Go ahead, Jay.
Yeah, I just want to add that our Clear Matrix platform should be up and running as a digital platform, and we will be able to do third-party administration services nationwide, and I think we talk about that a little bit more in the next part when we talk about the 340B program. The next slide, the COVID-19 response, and I mentioned earlier, but Pharmco has provided 1 hour PCR test. If you go out other places, you may need to wait 24 to 48 hours to get your PCR test. If you come into our facility and you want to wait, you can get results within an hour, or we'll email it to you. I'm traveling on Saturday, and I'm going to come get my test on Friday. I'm not going to be worried that I'm going to have my results. My results will be delayed. I know I will have them within 1 day. Other people, you don't know. You're hoping you get them within 48 hours. We also have started giving COVID-19 vaccines, and we've had over $1 million in revenue directly from the COVID-19 testing program. And as I mentioned earlier, we're very active. And if somebody needs us, we will go to them. And we give those results also immediately. It's been a very good revenue producer for the firm, and we've also helped to take care of the community. The 340B discount program, we provide 340B coverage. 340B are entities that are authorized by the government, and they're a discount drug program. We have pharmacy management services and third-party administration services for reporting and compliance on the 340B pharmacies and clinics. The 340B revenue was approximately $724,000, or a 264% increase when compared to Q1 in 2020. 2020 fiscal revenue was approximately $2.8 million, representing a sharp increase of over 300% for the fiscal year of 2019. The 340B program, which is government authorized, and it's a very nice program. The third-party administration program, we manage the clinics and the doctors' fulfillment of the 340B program, and it's a big help to them. When we launch our digital platform, the doctors will actually be able to get results on their patients' drugs at all pharmacies, not just us, within a 24-hour period, and we're looking forward to launching that program shortly. I guess the next thing I'd like to do is just show you our staff, and I have to tell you, I'm proud of the people we have working for us, and they're all dedicated to trying to keep people healthy. My CFO, Cecile, and my COO, Baruta, go out of their way to take care of the company and people. Liz, my pharmacy manager, and Pam and Mamina, they're constantly looking for ways to help people, and we're really proud of what they do, and we're proud of how we run the company. I like to say, and I tell everybody, we're in the business of keeping people healthy the way we work, and that's really our mission. But the healthier we keep people, the more money we can make. We're not dependent on you coming in our store and then looking around and buying lots of miscellaneous products. We're depending on taking care of the patient and keeping them healthy. Before we do the Q&A, Armin, do you want to take people on a tour of our facility?
With pleasure. Yes, let's get acquainted with our. This is one of our locations, located in Hallandale Beach, in Broward County. So follow me, guys. So this is where most of the data entry, communication with doctors, communication with healthcare professionals, with patients, and anybody pretty much who's involved in the patient life. This is where this is happening. So majority of this is our team of clinically trained pharmacy technicians that every day doing nothing but providing care and answering questions. And we get here over 500 phone calls on a daily basis. So we're keeping busy. And going this way, this is where the filling department is. So this is where I say the magic happens, right? So this is where all the prescriptions that are being processed by the data entry are coming here and being filled. So we have thousands of medications in the inventory, and we here at this location have probably about 70 to 80 employees. The company employs about 150 employees in total between 4 locations that we have. We service all of Miami-Dade and Broward, Palm Beach County, that 50-mile radius, Orlando, Orange County, and that 50-mile radius. So follow me. We have some of the robotic systems, and Jay has mentioned about the Smart Pack. We're very proud to be one of the few institutional pharmacies that are providing such an awesome alternative. So this is the Smart Pack. This is how it would be delivered to the patient. And by the way, 99% of our prescriptions are being delivered to the patient. So it's not a mail order. We're not putting it in a mailbox. We're delivering it directly to the patient or to the facility, whether it's a long-term care facility or it is a physician's office that would like to ordering, let's say, an injection and needs to administer it at the office location. So this is the Smart Pack, one of the most convenient ways of managing your medications. And of course, this is something that our doctors love, and they want as many patients as possible to be on that, because then it eliminates the risk or minimizes the risk of gaps in therapies and non-adherence to medication. So this way right here, we have the robotics that allow us to process medications, and instead of filling them manually, we have the robotics that actually goes ahead and fills the medication for us, puts a cap in, and all we got to do is touch it and go ahead and package it. So that's most of our operation here. I don't want to be wasting your time and bring you to the second floor of the corporate office, but we welcome anyone who wants to take a tour of our pharmacy location and our operations at Pediatrics here at Hallandale or Palm Beach or Orlando. All right, guys, so I'm going to give it back to you, Jay.
Thank you, Armin. Thank you for the tour, and it's nice to see that we have a beautiful facility. I forgot to mention, or I didn't mention earlier, just to give you a little idea about the company. We have approximately 520 million shares issued and outstanding. Our market cap is about 36 million at today. We file audited financial statements with OTC markets audited by PCAOB auditors, and we trade on the OTCQB market. I hope everybody enjoyed the presentation. If you have questions, we will be glad to answer them now.
All right, thank you guys. Yeah, great presentation. We do have a few questions, so let's start. How many locations do you currently have, and do you plan to expand, and if so, in what regions?
We currently have 4 locations. We have Miami, North Miami Beach, Hallandale, Orlando, and Davie. The Hallandale, Armin, yes?
And Palm Beach.
Palm Beach, yeah, we have the Palm Beach location. The Orlando location gives us the ability to service over to Tampa or Daytona Beach. And our North Miami Beach location, we can get same-day delivery as far south as Hallandale, as far south as, I can't think of its name, way down there in the south. Anyhow, within one day, we can deliver out of Palm Beach location within 24 hours up to Port St. Lucie and further north. And Homestead, that's the location. We can deliver to Homestead within 24 hours if you're familiar with the Florida area. We do have intentions of expanding. We have looked at various pharmacies to possibly buy or start from scratch, where we want to fulfill the whole state of Florida. We have licenses in 14 states, and we will be able to send prescriptions to those 14 states if we wanted to by mail. As I mentioned earlier, the TPA service, or third-party administration service, which is not a pharmacy delivery service, but a management service, we will be able to do that nationwide. So we do have intentions on expanding, and we're looking at opportunities that make sense to the company and our shareholders. We need to make sure that it will be profitable to the company, if not immediately, in the near future.
Perfect, thank you. Can you share some more details on your future plans for uplist in terms of S1 filings and your corporate roadmap for this?
I can say that the company's intention is to be fully registered. And aside from that, there's not much more I can say.
And do you plan on expanding out to other things besides medications, such as daily vitamins and whatnot?
If it makes sense. Currently, we do, if the people have requested, we do send to them their vitamins and supplements. We even package the vitamins and supplements in the Smart Pack for our patients who take them and have added them to the prescription list. So we are in that business. It's part of what we do because, again, we're back to the company's philosophy, which is to try to keep people healthy.
Talk a little bit about your marketing plan and your PR output in the coming weeks to increase shareholder value before your reverse split.
We will discuss that later today. We're going to be issuing a press release on that. But we're doing this presentation today mainly because we wanted to get our face in front of more people and help with increasing the shareholder value. And we will be doing several press releases in the next few days.
So with you turning to profit and such a bright future, what's keeping the stock price down?
That's the magic question. What's keeping the stock price down? If I knew, I would give you an answer. I'd try to find a solution. We think the company is tremendously undervalued and we thought it was closer to its real valuation in February. We don't really know why the stock is depressed at this time.
Where do you see your growth rate over the next 24 months?
We would like to double the size of our sales within the next 24 months. There's no guarantee, but our goal is to be at least twice the size. Our facility, which you were taken on a tour of, is currently dispensing about 50,000 prescriptions a month. And out of that location, we could do 150,000 prescriptions a month. In Orlando, we went from a small location to a 4,000 square foot location, and anticipation that with marketing, we will be able to double or triple our Orlando facility's output.
So with regards to your robotics filling the medications, are they double checked by a human?
Every prescription by law must be reviewed by a pharmacist. So even if a pharmacy tech who has at least an AA degree puts the pills in the bottle manually, or they get put in the bottle or the smart pack by a computer, a pharmacist must review that, and then it gets sent to pack to shipping. But nothing goes out without a pharmacist review.
Yeah.
Last question. Sorry, Armin, would you like to speak on that?
Right, and it's, you know, the efficiency is one of the most important things for us. So the robotics allow us to get the process of filling prescriptions much quicker because of the volume that we're doing and because of the volumes that we're expecting to do in the future. It is very important for us to be able to push as many prescriptions through robotics as possible so we can get them out to patients within 1 day or within 24 hours, because that's what separates us from everybody else. It's the doctors that they know that when they send the prescription to us, that prescription is going to be delivered to the patient within the next 24 and maximum 48 hours.
And just to add to that, if it's a stat medication, which needs to be taken immediately that day, we make our best effort to get it to the person that day. And, you know, I mean, if it comes in at 6 o'clock at night, it might be hard, but we'll even try. The other night, we had one of our personnel, he was leaving, and we said, hey, this person didn't get their medication. Will you stop on your way home and take it to them? And we have such dedicated employees. He said, yeah, sure, even though it's half an hour out of my way. But again, if we can, we want to get the people their medication as soon as possible because we're in the business of keeping people healthy.
Well, it's a good business to be in. So we appreciate your time for presenting with us today. There are a few more questions, but we will send them directly to you so you can answer them on your own. But thank you, gentlemen, and we look forward to your updates.
Thank you.
Thank you, Anna.
Thank you for having us, and we were glad to be part of the conference.
Good. We hope to see you again.
Bye-bye.
Bye.
Thank you. All right, everyone, stay with us because we've got more presentations coming up. And remember, you're going to experience a black screen for a brief moment as we move to the next presenter, but don't go anywhere. We're coming right back.